contrary to common belief, mental health cases do not increase during the holidays. With us today in the studio to share factual information about mental health during the holidays is psychologist and clinical administrator with Nevada County Behavioral Health, Dr. Cari Yardley. Welcome, Dr. Yardley. May I call you Cari?
You can. Hi, Lynn. It's nice to be here.
Nice to have you. So this is a really hard time for a lot of people, but I'm wondering, is it as hard as we have been led to believe?
That's a really good question. There is a myth about an increase in suicidality around the holidays, and it is actually a myth. It is not the truth. When we look at statistics just around the nation and within Nevada County itself, we have an increase in crisis incidents in late winter and also again in late summer. But around the holidays particularly, it's average. We have an average number of crisis incidents.
So that's interesting. I wonder where that myth came from.
Well, the holidays are associated with a significant amount of stress. Would you agree?
Yeah, sure.
Sure.
Look at my list that's not yet attacked.
Right. So we spend a lot of time really trying to manage the expectations of others around the holidays and the expectations within ourselves. Oftentimes we have these ideas, maybe Hallmarkish, around what a holiday should look like, what a family gathering should look like, what our relationships with others should look like. And those shoulds are a root of many stressors. Those are the things that make it incredibly hard for us to be present in the moment with the reality of what we have. And so when that happens, that discrepancy between our reality and the beliefs in our head or the stories we've told ourselves about how it should be, it makes it incredibly challenging to cope, and it increases our stress. So that is common during the holidays.
Sure. And do you find that this issue is more common among a certain age group? In other words, do we worry more about our seniors or our children? What's your experience?
Yeah, that is a really great question. And I don't know that I have the data with me or in my mind to be able to speak to that in particular. But the age groups that I worry about are our adolescents and our young adults. When we're in that age range of around 14 to 25, there are major life stressors, changes in our bodies, changes in our social dynamics, changes in who we live with and how we navigate in the world that create a lot of stress. And then also when we're thinking about our elders, those in the retired community or those who by nature of age are experiencing multiple losses around them, that can be a significant stressor during the holiday period as well, because holidays are associated with our memories and all the things and the traditions that we have held in that context. And so when there is a loss in our life, whether it be a loss in a relationship because we're no longer connected or a loss due to death, that can be incredibly hard as well.
Sure. So can you talk about what the county does offer and what the services are, how one who is worried about a loved one or a neighbor might go about directing, that person to the services and the help?
Yeah, that's a really good question. So in general, Nevada County has a few things available to the public. We in Nevada County have a crisis line, and I'm going to say that phone number and I'm going to say it slowly. It is 265-5811. And that is our Nevada County crisis line, which can access a person to talk to if you need support. And it can also deploy our mobile crisis team. And our mobile crisis team is made up of 2 behavioral health clinicians who come out and can meet with you wherever you are and talk about the things that might be happening in your life right now that are causing you stress. So that's available to everybody at any time. It's 24/7, whether you want someone to talk to or someone to come out. And then we also have 988, which is a national suicide hotline, and that is available for all individuals. You can call from any type of phone, and if you dial 988, someone will pick up the phone and be available to connect with you. Within Nevada County Behavioral Health, we serve individuals who are Medi-Cal beneficiaries.
I see.
And typically, if we're talking about over the age of 21, it's a person who might have a serious and pervasive mental health condition or a substance use disorder.
Right. What recommendations do you have for families or friends who are dealing with someone who's clearly having a crisis but refuses to get help refuses, any contact, whatever, with county services. What should someone do?
That's a really great question. So we have a couple of prevention type resources. So we have Mental Health Matters, and that's a campaign to really address the signs and symptoms of suicide, and then to also help create talking points to connect with people that you might be concerned about. And so that will give you information, it will give you statistics and data and ways to help bridge the gap with someone who might be suffering. Another thing that I would highly suggest is talking with a person. Mm-hmm. When we are able to communicate our concerns, and when we are able to be real and present in the moment, something shifts. And so one of the things that we tend to do when we don't know how to respond is we distance ourselves. And I think as humans, maybe the exact opposite is what is needed. And how do we join? And so finding ways to join and to connect with a person who is suffering is incredibly important, rather than leaving them alone. And then once you join and connect, we're in this together. And if we're in this together, here's what we could do. We could call our mobile crisis line and we could talk together and see if maybe you'd be interested in hearing what they have to say. If we're in this together, then we can reach out into the community around us and find things that you and I might want to go and do together, right, to get ourselves out of this present moment of hardship.
Such good advice. Do you think it's just really a matter of coming down to just being human beings with each other, I think, and being really listening. And I think the other thing that people do sometimes is distance on the one hand, but then try to give a lot of advice or be know-it-alls. Yeah. Does that sound right?
Do you like know-it-alls in your life?
I do not.
Yeah. I think we might all struggle with that. And sometimes we're so full of wisdom that we can't help but share it. But really, I do think that it's hard for me to know what you're experiencing. And it's hard for you to know what I'm experiencing. And the best way to do that is to listen. And even if nothing is to be said, it's to be side by side in that.
Right. Could you give me your cell phone number so that I can call you? Should I? Any issues during the holiday?
That I can give you our crisis line again.
Could you give that number one more time?
Yeah, it is 265-5811. And that's how you will access our Nevada County crisis team, who is able to come out and respond to you in person and to connect with you and help get you connected to your next step in your journey towards wellness and healing.
Thanks so much for the information, and thank you for all the work you do. It's so valuable in our community. I personally appreciate that so much. I'm sure our audience does as well.
Thank you.